Welcome everyone. I hope you can hear me all right. My name is Liz Smith. I am the Creeks Outreach Coordinator for the City of Santa Barbara Creeks Division. We still have some people dropping in, so we'll wait a few minutes to get started. I just wanted to share with you that this is our third Watershed Wednesday event that we have been working on the past couple weeks. Today, Jill Murray, our water quality research analyst, is going to be giving you a presentation on water quality and COVID-19. If you have any questions, please feel free to share them in the question tab. Jill's presentation is about 15 to 20 minutes long, and we will get to as many questions as possible after she's done. Let's see, letting you know that we will be recording this presentation and we'll get it posted onto our YouTube page, hopefully later today, and that's at youtube.com/sbcreeksdivision. And to learn more about our Watershed Wednesdays events, you can visit our website, which is sbcreeks.com, or our Facebook page, which is facebook.com/sbcreeks. And we hope to have something fun planned for you next week. So let's see, we've got almost 30 people here with us. We'll wait just a couple more minutes. And then we will have a few survey questions we'd like to ask everybody to participate in. So stand by for just a moment for us. Okay, so we've got, let's see, a few more people dropping in with us. Jill, are you just about ready here?
Oh, yes, I'm ready to go.
Okay, why don't we, do you want to ask your survey questions later on? Why don't we ask them all at that time, so that gives us a few more minutes for people to drop in.
Okay, perfect. So I should share my screen?
I'm going to
turn over, go to view. Okay.
I'm going to turn over control to you. Here we go.
Okay. Liz, can you see my screen fine?
I can see it, yep.
Okay, great. Thanks, Liz, for organizing this. And I really appreciate all of you tuning in. I know there's been a lot of Zoom time, and I really appreciate that you made the effort to come to our webinar on Watershed Wednesday. Some of you probably work in this field and probably know a lot more than I do about some of these topics. This presentation is intentionally non-technical and is geared towards helping our residents make informed decisions. So for those of you outside the city, I want to introduce you to the Creeks Division. We were chartered and funded by Measure B, which was a referendum passed by voters in 2000. And this gave funding to create the Creeks Division. Our mission is to improve creek and ocean water quality and restore natural creek systems. And we do this using stormwater management, water quality, and restoration projects. And we also conduct extensive water quality research. I'm not going to be talking about any of our research today. I'll just be summarizing what seems to be the current consensus on some of these topics. I encourage you to go to sbcreeks.com. You can learn a lot about our work there. So as I said, I want to give our residents some information so you all can make informed decisions about some of these questions. Is it safe to swim at the beach during our pandemic? Is it safe to walk and play on the beach during the coronavirus time? Are our creeks safe? And a very big caveat and disclaimer, this talk will give you information, but everyone must make their own decisions. This is not any kind of public health guidance. The LA Times caused quite a stir a couple of weeks ago when they published this article on the risks of even walking along the beach or swimming due to the possibility of sea spray aerosols containing coronavirus. And we and other groups received numerous requests for information and expressions of concern after this article came out. So I want to stop here, and Liz is going to give a poll. This helps us understand our audience a bit more. And she will be asking several questions about whether you live within the city, whether you've visited the beach recently, whether you've gone swimming or surfing, and whether you read that article or heard about that article or other follow-on articles about the risks of swimming and surfing.
Okay, so let's go ahead and give a couple seconds for people to answer this first question, which is, where do you live? Within the city, within the county, but outside the city, and outside Santa Barbara County. So we'll just take a few seconds here. Okay. And so here's our audience, just about almost half within the city, 50% within the county but outside the city, and 4% outside the county. Okay. Let's see, our next question here. Have you visited the beach during the coronavirus pandemic? And again, we'll take just about 10, 15 seconds here. Okay, and quite a few of you. So 76% have been to the beach. Thank you for sharing. We've got a couple more. Have you gone swimming or surfing in the ocean during the pandemic? Just a couple more seconds here. Okay, and so 39% said yes, 61% no. And finally, did you read or hear about an article warning against swimming and surfing? Great, you guys are so fast at responding to our questions here. Okay, and quite a few of you, 73% had heard or read that article. So thank you for answering those questions for us, and I'm going to go ahead and turn it back over to Jill.
Okay, thank you, Liz. Okay, so that's really helpful to know. Before I go any further, I want to get some of the jargon out of the way. So coronavirus is a class of viruses that includes SARS, MERS, about 20% of common cold viruses, and SARS-CoV-2. SARS-CoV-2 is the virus that we are concerned about. It's an acronym, which you can see on the screen. It causes the disease Covid-19, which is also an acronym that you can see on the screen. I am going to keep it simple and use just coronavirus and COVID interchangeably throughout this talk. Another technical term that we need to understand for this talk is the concept of viability. Viability is the ability of a virus to cause an infection. Sometimes viruses are counted in the environment, just their DNA or RNA is measured, but the virus is not actually infective. And so that's, it's one thing to measure them, it's a whole nother set of lab work and tools to be able to determine the infectivity. Throughout this talk and in articles, the terms viable, infective, active, and let's see, I can't see my screen, are used, these terms are used interchangeably. Luckily, coronaviruses are easy to kill. Due to some of their properties. This lipid envelope makes them this class of viruses, fairly susceptible to disinfectants. and that's related to their viability. So we can probably count many more than are viable in the environment. Okay, so in thinking about risks to surfing and swimming and being at the beach, it's really important to think about and use common sense. So we need to think about how the coronavirus is transmitted. The number one method is person-to-person close contact, where somebody coughs and sneezes and these larger respiratory droplets go into someone's mouth or nose and make that person sick. This definitely happens. There's been documentation, and it's the likely cause of most cases. There's also the potential surface contact. This is when a surface is infected by somebody's respiratory droplets, for example, and then someone touches the surface and then touches their own mouth, nose, or possibly eyes. This is probably a method of transmission. It's probably less common. Really not much hard science is known about this right now. Other than that, the virus can last on surfaces. Respiratory aerosols, these are the tiny particles, not the large droplets that are probably land within 6 feet. These are the tiny particles that could possibly be transmitted when breathing and talking. This is probably a mode of transmission, but again, little is known. The fecal oral route. This is a really common way for diseases to be transmitted, generally GI bugs, the stomach bugs that go around preschools. Normally, we wouldn't tend to think about this for a respiratory illness, but it's been shown that stool and wastewater can actually contain high numbers of the coronavirus. It's not known how infective they are, and it's not likely that this is a method of transmission, but little is known. This would include things like foodborne transmission and waterborne or swimming-based transmission. Then last on this list is sea spray aerosols. This is what was discussed in that LA Times article. This refers to the possibility of ocean water, which could contain wastewater effluent or urban runoff, being aerosolized during spray containing the coronavirus and then getting breathed in by people at the beach. At this point, this is a hypothesis put forward by Kim Prather at the Scripps Institute, and she and others are working on a large project to understand whether this is a possibility. The amount of research that is being published right now on coronavirus is just going up about as fast as the disease curve itself. And a lot of this includes preprints. So these are potential journal articles that haven't even been peer reviewed yet, and they're going straight into popular media accounts. And so this is what we know now. This could be turned entirely upside down within the next year or two as more research is done. Okay, so onto the heart of the talk: ocean swimming and surfing. Let me say there is no official guidance that I can find on whether on any health risks for swimming and surfing. There is, I would say, some consensus among agencies and industry groups. So let's go through the methods of transmission. Person-to-person transmission when you're out swimming and surfing, that's not likely. Surface contact during transmission, that's not likely either, but don't hand your bar of surf wax to someone else out in the water. Respiratory aerosol transmission, and this would be the coughing and the sneezing. This would not be higher than a higher risk of transmission than when you're doing any other activities. So now we move to some of the other routes. Fecal oral transmission. The scientific consensus says this is not likely, but there are some potential routes. For one, treated sewage. Treated sewage, to date, there has been no evidence of viable coronavirus coming out of wastewater systems and being discharged into the ocean. And I recommend, and I have links at the end, following the Water Environment Federation. They are very good about compiling research updates, and this was just updated May 5th. So they're a good group to watch because they really care if, for example, people working in sewage treatment plants are getting sick at higher rates than the general population. Okay, then there's also the potential for runoff and untreated waste. For example, open defecation among creeks and then getting into the ocean, and even the possibility of swimmers releasing some of the cells from while they're swimming, some of the virus while they're swimming. This is potentially possible, and it would lead to extremely low concentrations of probably not viable viruses. Thus far, we have no evidence of viability in stool. This is the current research. So taking this combined, we really see that right now the possibility of fecal oral transmission in the ocean while swimming is no to low to unlikely. The sea spray aerosols. This very little is known about this yet, and again, this risk of transmission would be no higher than beach walking. So we'll get to the sea spray on the next page. I want to say that Kim Prather, who was quoted extensively in that LA Times article, followed on quite quickly with a Facebook post in which, and I recommend reading it. It has a lot of interesting perspective in it, but the main point is that a lot of what she said was taken out of context, and I'll add to that on the next slide. Okay, so now beach recreation other than swimming. Let's go through the methods of transmission again. Person to person, yes, riding to the beach in a car, sitting or playing with someone side by side, walking too close. These are potential routes of transmission that could take place anywhere that people gather. Surface contact transmission. This could happen in bathrooms, parking meters, shared items, again, similar to other locations. Respiratory aerosol transmissions. These are the coughs and the sneezes. Again, riding to the beach. Sometimes beaches get so crowded that people really aren't keeping 6 feet apart. Fecal oral transmission, again, that potentially happen in bathrooms. This would not be any different at the beach than any other of the built environments that we experience. And the big one, sea spray aerosols. Very little is known. There's a current research project, but from what I have read, I think that it's not likely. It's important that we rule out this potential route of transmission. And I think this article about her research that came out recently says it quite well. The main point Prather wanted to make was that was not the risk from the surf spray. It was really that 6 feet, walking and being 6 feet away from someone isn't just a magic distance. We've got to also consider some of the smaller droplets that are smaller aerosols that are could exchange among people in any environment. And now some of you might be thinking, but I just saw some articles about sewage and sewage surveillance, and that gets pretty confusing. And that is not geared, the research going on now that has received a lot of press, as it should, is not about the risk from swimming. This is about a really neat, interesting method to track infections among populations. And so that is actually testing what comes into the sewage treatment plant for the coronavirus. And people are doing this throughout the country. We are really lucky to have Dr. Patricia Holden at UCSB, who is doing this with some funding from UCSB's Coastal Fund, and she's testing influent at El Estero and Montecito Treatment Plant. But this again, the virus is treated very well, highly disinfected, going through the wastewater treatment plant, and from what people can tell so far, is not coming out through treatment in any kind of infective form. So getting towards wrapping up, how can we stay safe at the beach? We can social distance. I love this picture. You can see there are clusters of what are hopefully family groups, or at least groups of people sharing their home, and they're spread out pretty well. We can use good hygiene. So if you are, throwing a Frisbee, make sure you are disinfecting that and disinfecting your hands afterwards. And some people are going to choose to wear masks. Another concern, how can we keep our beaches open? We really need to, this is my only PSA, we really need to practice social distancing. And I was just checking Twitter this morning, and at about 8, I think, John Palmentary posted that Carpinteria is going to close their beach parking lots this weekend in an effort to keep beaches less crowded. So myself, I love to go to the beach. I do not tend to go on the weekends. I go when it's less crowded, maybe take dinner down to the beach and go for a swim then. Okay, some additional water quality topics that you might be interested in: creek water quality, swimming at the river. The current consensus is that fresh water is safe for swimming. There are places that do get really crowded. I wouldn't feel comfortable swimming in a really crowded swimming hole with water that's not flowing. Pets and water quality. I know a lot of people take their dogs up walking on the trails. I haven't found any information about transmission with pets and water quality. Drinking water quality. It's well established that chlorine and other disinfection processes eliminate the risk from drinking water. And last, treated sewage. As I said, the treatment plant disinfects, and the sewage does not have the treated sewage does not have viable viruses as far as we can tell, and recycled water receives even more treatment. So, in conclusion, will you get sick from surfing or swimming in Santa Barbara? Probably not, but make your own decisions. Will you get sick from walking or wading if you stay greater than 6 feet away from others? Probably not, but make your own decisions. Should you drive with friends to a crowded beach, hug them, and share sunscreen, food, and frisbees? Definitely not. We need to social distance to stay healthy and keep our beaches open. Should you go to the beach if you are sick or have had close contact with someone who has been diagnosed with COVID before your isolation ends? Absolutely not. And should you base your understanding of coronavirus on headlines? No. And I think this LA Times article that received so much traction is such a great case study. On the one hand, it really scared some people unnecessarily, and the author was able to address that, or not the author, the researcher was able to address that. It also led to, I think, some important research and being taken on by some of the nonprofits. I've heard about some more activity in response to that article. And I would bet that we'll see an article in the next 6 months to a year that says coronavirus has been detected in ocean water and sea spray, because it probably gets a little bit of it, probably gets everywhere. We're going to need to know a lot more before we panic upon seeing that headline. We need to know how consistent it's detected, how high the concentrations are, how infective is it, and given all that, what is the dose response for people? And that putting all of those together is called quantitative microbial risk assessment, and that's what will have to take place before we have a complete understanding of what is going on in the ocean environment. And with that, I will thank you for your attention and take any questions.
Okay, Jill, thank you. We do have a few questions that have shown up thus far, but I want to remind everyone to please submit a question if you have one. So our first question came from Hans Betzeltz, and the question is, how soon can I safely swim in the ocean, and what would be the safest beach to do so?
Okay, thanks, Hans. Again, I'm not going to give any public health advice or medical advice. I'm going to tell you what I do. I swim now. I go to the beach when it's less crowded, and for other reasons, would probably not swim right in front of a urban storm drain right after a rainstorm.
Okay, thank you. One person asked, Jesse Doherty asked how many people were attending to put the percentages of our poll questions into context, and at that time we had about 47 people responding, so just an FYI. And then we had 2 people, Laura Francis and Jennifer Brote, both asked about swimming pools, if you had any input on swimming pools.
Great question. Okay, swimming pools are treated with, as long as they have a functional disinfection system, which disinfects for bacteria and other viruses, they will certainly disinfect for coronavirus. Coronavirus, because of this class of viruses, because of this lipid envelope that it has, as I mentioned, it makes it really susceptible to disinfection, and other viruses, such as norovirus or other things that cause stomach bugs, are harder to disinfect. And if your disinfection process is fully functional, you will have no problem eliminating infective coronavirus.
Okay. Okay, Allison Solomon asked, what about the virus on beach sand?
That is a question that hasn't been addressed through any research yet that I know of. I have heard some rumors of interest on a listserv that I follow. I don't expect that it would be a large driver of transmission, for the same reason that there isn't evidence that it's a large driver of that surface contact is not a large driver of transmission outside the beach environment. So kids do eat sand, it's true, and that sand could have some coronavirus on it. A complete microbial risk assessment would have to be completed, but I find it hard to imagine how that would be riskier than other routes of other forms of surface contact.
Okay. We had a question from Jennifer Brote. What about outdoor showers at public parks or pools?
Outdoor showers at public parks or pools use potable water, which is disinfected, and so it shouldn't have any, even though that is definitely aerosolized as the shower water comes out, that shouldn't have any viable coronavirus in that water.
Okay. Sue Sadler asked, I have been told that sunlight kills the virus. Do you know anything about that?
Well, I've heard the expression sunlight is the greatest disinfectant, but I don't know any of the current science on UV disinfection.
Okay. So that was our final question. If anybody else has any questions they'd like to add, please feel free to do so. I will remind everyone that we have been recording today's presentation, and I will try to get it up to our YouTube page today. That's at youtube.com/SB-Creeks-Division. To learn more about our Watershed Wednesdays series or the Creeks Division in general, please visit our website, which is at sbcreeks.com. While you're there, you can sign up for our email newsletter. We have both a monthly newsletter, and we also have one dedicated just to Watershed Wednesdays, which is coming out a little bit more frequently. Also, please visit us on Facebook and Instagram. We are at SB Creeks on both of those sites. And we just had another question drop in here. Jesse Doherty commented, taking a shower at the beach involves pressing a shower head that others touch, and the showers are not 6 feet apart. So any thoughts on that?
That's an excellent point. I would use my elbow to turn on the shower and only use one when there wasn't somebody within 6 feet. That's a great example of using common sense to keep yourself and others safe. But we may take other questions, but I want to just say, while I have a chance, I really appreciate all of you listening and all of your excellent questions, and I hope everybody stays healthy out there.
Okay, so another comment. I imagine the biggest risk, this is from Laura Francis, I imagine the biggest risk for swimming pools would be if people are training hard and breathing on each other at the end of the pool, swim clubs, etc. So kind of a comment.
Yes, and I think a lot more needs to be learned about that form of transmission. At this point, there are some anecdotes. Some of you may have read the story about the choir in Seattle that seem to transmit the virus during singing, but again, so much more needs to be learned. We're months to a couple of years away from really understanding the quantitative risk from those activities.
Okay, Dan DeBrew asked, is this webinar recorded? Yes, Dan, it is being recorded, and we will hope to have it on our YouTube page later today, youtube.com/SB Creeks Division. Nicole Keel asked, who decided 6 feet was safe, a safe distance?
I don't, this is again not my area of research. I did read on Kim Prather's commentary that the 6 foot was determined early last century during the Spanish flu, but I'm not sure if that's true. That is one thing that I read.
Okay. Sue Sadler asked, why don't the local pools open if social distancing is practiced?
That I think you would have to take up with someone who makes those decisions in Parks and Recreation.
Okay. And that was our, let's see. Thanks, Jill and Liz. Excellent presentation and great job on presenting the science and answering questions. That came from Laura Francis. Thanks, Laura, for tuning in. Let's see. Eric McCurdy suggested that people consider the wind in terms of their 6 foot distance. So any thoughts on that? The wind carrying the virus further potentially?
It will be in trouble if we all try to be downwind from each other.
Okay, so it looks like that's it. Again, thank you so much, everyone. Oh, did you have anything else to add, Jill?
No, I was to say if we all try to be upwind from each other.
Okay, so thank you again, everyone. Jill, I think you had a slide with some extra links.
Oh, right. Okay. So these are some compilations of information that you can follow. And again, I really recommend the Water Environment Federation. Surfrider has a really good summary of information. I'm not sure if that will continue to be updated. WebMD actually has a very good summary. The California Water Board has an excellent fact sheet on, on wastewater. And the CDC also has a compilation of guidance for water and swimming.
Okay, and Jill, one more thing here. Aaron Ives asked for a quick rundown of key points for those of us that got here late. So maybe your slide that said, should we visit the beach? Here we go, conclusions.
I'll let you read that
okay, so
yourself, or you can read it, Liz, if you want.
Oh, that's okay. I think everybody can take a look.
Yeah.
All right, so we got some other nice compliments, so thank you, everyone. We're glad that you tuned in. We just have scrambled to try to find new ways to reach out to the community and get information to you, so we really appreciate you tuning in with us. Let's see, Kate Carter said, I missed the last comment about testing. I'm not sure.
I didn't hear that.
Okay. I don't think we had anything about testing. So Kate, if you do have any, oh, she said, was that not what you were talking about at the end?
The last question, the last question was about wind and being downwind from somebody.
Okay, but Kate, if you or if anyone else have any questions for us, you can also email us creeks@santabarbaraca.gov, or again, visit our Facebook page at SB Creeks, and we are happy to answer more questions if we can. So thank you so much, and we will wrap it up. Everyone have a great day.
Bye, thanks.
Thank you.